So happy holidays, everybody. Thanks for joining me for What's the Point of Use Cleaning. I do want to thank Metrex for sponsoring this continuing education presentation. We all need those continuing ed credits for something. IPs need IPUs. So it's great that they're willing to put these kinds of presentations on. So some of the things we're going to talk about today are what is point of use cleaning and why it's important, biofilm formation, and some standards, guidelines, accreditation, and survey expectations. Now let's talk a little about healthcare-associated infections, or HAIs. They're infections that patients acquire usually within 48 hours or more after hospitalization while receiving care in, honestly, any setting. Surgical site infections, SSIs, occur within 30 days after receiving care or up to 1 year after receiving an implant. Now, HAIs are often associated with medical or surgical procedures where devices are used. The 5 most common HAIs are catheter-associated urinary tract infection, or CAUTI, and that's the leading cause of HAIs. Then we have surgical site infection, SSI, which occur in up to 25% of major surgical procedures. Clostridioides difficile, which causes diarrhea, and it can cause a life-threatening colon inflammation like toxic megacolon. We see these HAIs about 12%. Central line associated bloodstream infections, or CLABSI, is at about 14%. And methicillin-resistant Staph aureus, or as we all know it, MRSA, is at about 7% for HAIs. Now, a surgical site infection could develop as a complication after a surgery where a permanent implant was placed, like a pacemaker, or an orthopedic implant, like a knee or a hip. SSIs can also occur after surgery if no implant is left in place from improperly reprocessed surgical equipment, and that's just one possible source. Now, SSIs can also result in the need for further interventions, such as wound debridement, or in the case of an implant, sometimes removal is necessary due to infection or other extenuating circumstances. So SSIs are a significant cause of morbidity and mortality after surgery. They cause about a 7 to 10 day increase in hospital stays and about a 20% increase in hospital cost. And this is why reprocessing of medical devices is so critical. Now, HAIs are an unintended consequence of healthcare. In the US, you have a 5% chance of getting an HAI once admitted to a hospital. And that's simply stated as a fact. About 1.7 million people per year will get an HAI, and almost 100,000 will die. HAIs place a physical and emotional toll on patients. Patients endure higher mortality, longer stays, more treatments, and possibly physical isolation due to being placed on those transmission-based precautions. HAIs also add billions of dollars to healthcare costs in the US annually, yet they're the #1 preventable cause of death. Now, the US Food and Drug Administration, the FDA, defines a medical device as any instrument, apparatus, implement, machine, appliance, or implant intended by the manufacturer to be used for a medical purpose. And the FDA is responsible for regulating the safety and effectiveness of medical devices. They require medical device manufacturers to provide written reprocessing instructions with a specific reprocessing regimen that is specific for that particular device, explains how to thoroughly clean the device and what to use or what can't be used on it, provide clearly written and comprehensive instructions for use. That's those IFUs. Acceptable reprocessing of reusable medical devices is critically important in protecting patient safety because reprocessing is intended to remove blood, tissue, and other biological debris and to inactivate microorganisms so those devices are safe for use by the next patient. Now, reprocessing is labor intensive, it is time consuming, and requires great attention to detail. It's performed by staff trained at, there's large healthcare facilities that do it, small inpatient and outpatient facilities. There's small medical office suites that reprocess some things, ambulatory surgical centers, and now we see more standalone reprocessing facilities. And according to the FDA, reprocessing reusable medical devices generally involves 3 steps. Okay, and the first is at the point where the device was used, that point of use, where the device receives initial decontamination and cleaning. And steps are also taken at this point to prevent drying of blood, tissue, and other biological debris and contaminants on the device by keeping them moist. Now, the second step is the transfer of the device to the reprocessing work area where it's thoroughly cleaned. And the third step is the device is either disinfected or sterilized, and that depends on what it's used for and what it's made of. And then it can either be stored or rerouted back into use. So which step do you think is important in device reprocessing? Let's find out. But first, we're going to run a poll. And I don't see it.
All right.
Nicole?
Yes, I'll launch it.
Zoom, love it.
Okay. Which
Poll number one.
are you currently performing point of use?
Yes.
I will launch it.
Sorry, everybody, makes it more interesting. Okay, the question is, are you currently performing point of use cleaning? Everybody's plugging it in, keep going. And 100% have answered, so I'm going to end the poll.
Mhm.
Let's see our results, everybody. And there they are. 94% are using point of use cleaning, yay you. 2% are not. We'll talk about that throughout the presentation. And 4 are unsure. So something to have on your radar if you're doing any instrument reprocessing. Okay. Let's get rid of that. Let's keep saying share results. We'll get rid of that. Okay, sorry, everybody. Yikes. Okay, so that was actually a trick question. All the steps in device reprocessing are important, but point of use cleaning is the most important step. It assures reprocessing is effective, and it helps to efficiently move that device along the reprocessing process, making it safe for reuse on other patients. Now, one thing to understand is point of use cleaning is not a single event, but it's a process that makes all the difference in the final steps of device reprocessing. If you've worked in or observed device reprocessing, you know that point of use cleaning involves several steps that go beyond cleaning to remove just gross soil. So point of use cleaning process starts with wiping instruments down and irrigating instruments with lumens or cannulated instruments. And this removes gross soil so biofilms don't begin to form. Next, we disassemble instruments with multiple pieces to allow cleaning solutions to contact all of the surfaces. Now, if cleaning solutions can't reach all the device surfaces and they can't get into those crevices or those hinges or all those little areas that they need to go, that organic material and debris can remain on the instrument, so proper disinfection or sterilization isn't achieved. Then we apply a treatment product or a moist towel to keep instruments moist, and this helps make the cleaning and reprocessing and decontam easier because soils aren't dried on or crusted onto the instrument. Then you should identify instruments that need repair or shouldn't be reused due to condition. And condition really refers to things like instruments that are stained, corroded, pitted, and there's quite a few more things that would indicate that that instrument needs to be taken out of use. Then you should separate the instruments into reusable, single use, and waste, and get ready to transfer those instruments to decontam for further reprocessing as soon as possible. Now, point of use cleaning is defined as the removal of gross soil from a device that occurs either periodically during the procedure or immediately after using it. And this is key at the place it was used, the point of use. Now, that can be at the bedside, it could be in a procedural area in any setting, the OR, clinics, the ED, anywhere it's used. Point of use identifies the ideal place for cleaning to occur. And point of use cleaning shouldn't be confused with the cleaning that occurs further down in that decontamination process. Think of point of use cleaning as the where of the start of decontamination. And cleaning is the most important step in any process when you're trying to achieve disinfection or sterilization. Why? Because if it isn't clean, it can't be sterilized or disinfected. Those inorganic and organic materials that stay stuck on the surfaces of devices, they can also cause pitting and corrosion, shortening their use, but more importantly, they interfere with the effectiveness of disinfection and sterilization. So this places the next patient and the instrument at risk. How? Because instruments that aren't point of use cleaned either periodically or immediately after use can allow soils to dry, making these devices so much harder to clean. Things like dried protein and blood bond really tightly to instruments by fibrin bands, and that requires a lot of serious, I don't want to say scrubbing, but mechanical action to help break those bands down. And also, dried blood can harm devices because it has a high salt content, so it's very corrosive. Now, when devices start to rust and pit, there's really no way to restore them to a completely smooth surface, so they can be safely cleaned, disinfected, or sterilized. And because of that, you could be placing patients at risk for an infection. Point of use cleaning is critical for minimizing contamination. It improves the effectiveness of the decontamination process by removing substances that can dry and make reprocessing more difficult and take longer. And it does help prolong the life of instruments by reducing contamination and preventing biofilm formation. Appropriate point of use cleaning is a time commitment, which means your facility must be prepared to support staff and give them the time needed to appropriately care for medical devices. So don't skip this step. Now, biofilm formation is one of the risks associated with inadequate point of use cleaning. Biofilm is a biological film that's created when microorganisms stick to a surface and they kind of bind together in a matrix and they form a thick, sticky gel-like substance. And a simple example of biofilm is dental plaque. It can't be easily scraped off the surface of your teeth. That's why cleaning your teeth regularly is important. Now, when biofilm matures, it releases free floating cells and they can deposit these in the surrounding environment and potentially into the patient. And this results in a massive infusion of bacteria that can cause a difficult to treat infection. And in the perfect environment, some microorganisms can reproduce in between 4 and 20 minutes. This is why point of use cleaning is so important. Now, point of use cleaning is a priority during and after any procedure because biofilms can be found mainly on devices that stay moist, devices like catheters, coronary artery stents, prosthetic implants, scopes, especially endoscopes, IUDs, ocular instruments, and certain surgical instrument sets need special attention at point of use. Now, orthopedic and neuro sets are some of the most likely to be contaminated with large amounts of gross soil, like bone and tissue. These instruments range from large, flat serrated instruments to very delicate hinged instruments with lots of nooks and crannies for biofilm to hide out. Flexible endoscopes have an elevated risk of developing biofilm due to those long, narrow cannulas that can become contaminated during the procedure. Now, if that endoscope is not point of use cleaned immediately following the procedure, soils can dry and hinder the cleaning and disinfection process, especially in those cannulas. Now, implants. Prior to surgery, inadequate reprocessing was identified as a cause of implant contamination. And during surgery, aseptic handling of all implants and instruments is required. In fact, implants should not be allowed to have soil dry on them during handling. And many implant manufacturers now state that the implant can't be used if it touches human blood or tissue. Then we have ocular instruments that require special attention because residual proteins left in those little tiny cannulas can lead to an acute severe intraocular inflammation called toxic anterior segment syndrome in the next patient. So be aware and extra careful when point of use cleaning these devices because they have a greater potential to develop biofilm, which can lead to device-related infections. Now, once biofilm has formed and stuck to a surface, standard cleaning procedures might not be enough to remove them. that protective gel of the biofilm matrix. It prevents the penetration of most detergents, disinfectants, and sterilants, and it can allow microbes inside the biofilm to survive the reprocessing process. So on this slide, number 1 is biofilm inside a medical device. Number 2 is biofilm on an indwelling urinary catheter. Number 3 is biofilm around a dental implant. That's gross. Number 4 is part of a titanium hip implant that's covered in biofilm. And number 5 is the distal tip of a colonoscope with biofilm on it. Now, the fluorescence is just used to help us see that biofilm better. Detecting biofilm is a challenge. Often it isn't detectable or visible to the naked eye until the biofilm has matured and multiplied in extreme cases like those on this slide. The best strategy to stop biofilm is to prevent their formation by removing gross soils where? At the point of use. Now, ANSI, the American National Standards Institute, and AMI, the Association for the Advancement of Medical Instrumentation, Standard 79, 2017, revised in 2022, provides guidelines and recommendations for reprocessing medical devices in healthcare settings, and regulatory agencies follow these and other guidelines. Section 6 of that ANSI-AMI Standard 79 specifically states, preparation for decontamination of instruments should begin at the point of use. To prevent the formation of biofilm and to reduce the risk of corrosion, cleaning and decontamination should occur as soon as possible after instruments and equipment are used. Now, if we look at the standard a little further on, Section 6.3 specifically refers to point of use cleaning. Section 6.3.1 is the handling of instruments during the procedure. They say throughout the surgical or invasive procedure, instruments should be wiped to remove gross soil, and cannulated or instruments with lumens should be irrigated without creating aerosols. And we go down to look at the removal of gross soil. Gross soil should be removed as soon as possible because it reduces the number of microorganisms on the item. It reduces the nutrient material that those microorganisms use to grow. It prevents soils from drying on that equipment. It reduces the potential for environmental contamination by aerosolization or spillage, and it minimizes corrosion risk and damage to devices. So if you perform any device reprocessing, I hope you have and follow this standard. So Nicole, it looks like it's time for another poll.
Okay, let me get it launched. Launch it. We are launched.
All right, here we go. Are you aware of ANSI-AMI Standard 79? They're filling in like crazy. Okay, let's, still going.
All right, I'll go ahead and end it and share.
Okay. So the results are that about half are aware of these, and probably other half are not, or they're unsure. So if you're doing any instrument reprocessing, please take a look at this standard. You need to be following it. If you are audited by anybody, you can get in big trouble. Okay, we'll end that poll there. Okay, next slide. Okay, so point of use cleaning isn't a theoretical practice or just something infection preventionists or the SPD folks talk about. And this is important for those of you who don't follow it or you're unsure. If you're not following ANSI-AMI Standard 79, you can have serious negative outcomes on patients and facilities. I have 2 examples on this slide. The first one, in 2013, after 24 infections were reported in French and Dutch hospitals, Olympus alerted European customers that one of its scopes could become contaminated due to a design flaw, making it hard to clean. Now, outbreaks of infections at several US hospitals followed over the next 3 years because that scope was still out there. And during that time, there was an outbreak of carbapenem-resistant Enterobacteriaceae, CRE, at UCLA Medical Center that killed 2 patients and potentially infected 200 others. At least 35 people at U.S. hospitals have died since this 2013 outbreak after suffering infections from contaminated gastrointestinal scopes manufactured by Olympus. Another example, in 2018, a hospital in Denver halted surgeries after the Joint Commission investigation found 129 instances of incomplete removal of gross surgical contamination over 13 months. Now, failure of the hospital staff to perform point-of-use cleaning of surgical instruments contributed to contaminated instruments being used in procedures that they had received inadequate sterilization, putting nearly 6,000 patients at risk for surgical site infections and exposure to HIV and hepatitis. So if your excuse for not performing point-of-use cleaning is not having enough time, think about these two instances that resulted in patient harm. And if you believe it costs too much labor to add point-of-use cleaning to room turnover, consider what it costs these hospitals and companies in patient lives, lawsuits, and reputation. Facilities that are reviewed by the Joint Commission should be aware that surveys routinely identify breaks in processes that might increase the likelihood of ineffective instrument cleaning. Now, Joint Commission surveyors refer to standards and guidelines developed by AMI and the Association of Perioperative Registered Nurses, that's AORN, and others when they're inspecting instrument processing areas. Surveyors also refer to your facility policies and the manufacturer's instructions for use to ensure that personnel are performing tasks correctly. The topic of point-of-use cleaning has been a growing trend in surveys. In fact, the Joint Commission developed new scoring criteria for infection control standard IC 020201. Previously, the scoring and recommendations were based on visibly looking for bioburden and dried blood on instruments, but the new scoring criteria state that surveyors may observe a case or procedure to assess with their own eyes whether items are being wiped and cleaned at point of use. So in your facility, you can expect surveyors to ask staff how instruments are point of use cleaned, to see instruments that have just come from surgery, observe how instruments are transported, and even open a set of sterile instruments to check for the presence of bioburden. Is your facility ready for this kind of inspection? I hope so. Now, also for point of use cleaning, surveyors can also ask, are users removing soil and keeping instruments moist as indicated in each instrument's instructions for use? Now, the Joint Commission says facilities should perform careful inspection of critical instruments and devices for bioburden and soil. But the Joint Commission doesn't stop there. The condition of the device is also a Joint Commission concern. So in their own words, they expect devices that have oxidation, corrosion, pitting, discoloration, cracking, peeling, chipping, lifting, or improperly applied identification tape, or etching that leaves rough or frayed edges. They expect those devices with those things to be pulled from service if found at point of use. So surveyors might also ask, can staff at point of use identify when an instrument shouldn't be used, even if it's in sterile packaging? And do they know how to return and report the occurrence for quality monitoring? Yow. Point of use cleaning and inspection of condition are critical steps in protecting patients from potential cross-contamination. Understand that failure to comply with industry standards for point of use cleaning, like that AMI Standard 79, will result in a Joint Commission citation, and it could be one as serious as immediate threat to life. Now, the AORN and the AST guidelines, AST is the Association of Surgical Technologists, their recommendations follow the AMI standard almost exactly. In 6.1, they say perioperative personnel should begin preparation for an instrument's decontamination at the point of use. 6.1.1, during the procedure, you should remove gross soil from the instrument surfaces. 6.1.2, irrigate instruments with cannulas or lumens at frequent intervals during the procedure. And after point of use cleaning, you should saturate the instrument with either some kind of treatment product or a wet towel to keep the instruments moist. So pretty much almost verbatim. Now, one misconception about point of use cleaning is that it only needs to be performed after the procedure is completed. And since the goal of point of use cleaning is to prevent soil from drying on instruments, there's a lot to be done during the procedure too. It is absolutely critical to wipe off and flush soils from instruments during the procedure. If this isn't done, used instruments could be left to dry for hours, especially during a long procedure, making them incredibly difficult to clean and delaying the reprocessing process. So this regular wiping and flushing of instruments, it helps remove soils which become very difficult to remove when dried or crusted on that instrument. An example is the removal of biofilm from a lumen is difficult because the removal process requires some mechanical action, and that can potentially damage the instrument. So you want to avoid that. Remember, the practice of wiping and flushing instruments during the procedure is consistent with those ANSI Standard 79, ARN, and AST guidelines, and should be implemented in every facility that's reprocessing any kind of device. Now, point of use cleaning during the procedure also reduces the number of microorganisms by reducing potential growth medium. It reduces potential for environmental contamination. It minimizes corrosion risk, and it increases reprocessing efficiency and turnaround time. Please note that the soaking liquids in the OR should be sterile water only. Saline should be avoided for any instrument because saline is corrosive to the surface of instruments, and it will cause premature rusting and damage. The steps on this slide are from the AORN audit toolkit. If you don't have them or haven't looked at them, I suggest you take a peek. Now, after the procedure, when the patient has left the room, point of use cleaning focuses on preparing for transport to SPD. Now, the process is to remove any remaining gross soil. You're also going to drain off any remaining soak liquids that you use during the procedure. Instruments should not be transported in soak liquids, and that's per that AMI ST79 standard, device IFUs, and AORN. Next, you must maintain moist soils, and this step can be performed at the back table of the OR or in a soiled utility room. So after the point of use cleaning, you apply a treatment spray or a moist towel. And then one thing to note is to make your treatment spray more effective, use a solid pan under those perforated or mesh instrument trays. Otherwise, it will be a big mess. Make sure you focus your treatment spray on difficult to clean areas like box, locks, serrated surfaces, and jointed or hinge parts of devices, and follow your manufacturer's instructions for use. So once those gross soils have been removed from instruments, the soaking liquids have been drained off, and the instruments have been treated to stay moist, the instruments need to be prepared for transport to CSS or SPD. Now, I know this sounds like a lot, but to comply with these recommendations and guidelines, a process change in the OR and other procedural areas might be needed. But if you think about it, if staff get into the habit of performing point of use cleaning as soon as the device is no longer being used, then cleaning at the end of the procedure will be easier, and the time required for cleaning will also be reduced, reducing reprocessing time. But more importantly, the risk of a contaminated instrument getting through the entire reprocessing cycle will be reduced as well. Now, a little bit about flexible endoscopes. They have an increased risk of developing biofilm due to those long, narrow cannulas that can become contaminated during the procedure. At the point of use, flexible endoscopes and accessories should be cleaned as soon as possible after the endoscope is removed from the patient or the procedure is complete, before organic material has a chance to dry on the surface or in the channels. And make sure you're following the manufacturer's instructions for use. And you can see the steps here. Make sure when you're washing it, you're using a cleaning solution that's formulated for the scope. When you suction that cleaning solution through channels, remember that dual channel scopes require aspiration of detergent through both channels. If there's any removable parts, you need to take those off and soak those in the detergent solution. And if you think you're going to have a delay, then you have to process for a delay per the IFU of that instrument. Now, one thing to also remember is that in addition to these point of use cleaning requirements, many scope manufacturers now require that scope cleaning begin within 1 hour after point of use. And scopes that aren't properly point of use cleaned or have been left to dry for longer than 1 hour after point of use cleaning may need additional reprocessing. So keep your eyes on that. Okay, Nicole, how about poll number 3?
All right. Poll number 3 is, which point of use cleaning product are you using?
Yep.
All right. Launched.
And this isn't a trick question.
And it's anonymous.
Yeah, so, and you can do a short answer, so look out.
We won't rat you out.
Mm-mm.
Ooh, 34, 35.
What about the rest of you?
All right. I'll go ahead and end it
Yep.
and share the results. Let's see. Oh.
Where are they?
Oh, okay. I'll go ahead and announce them. We have Blue 65 transitioning to pre-cleansed gel, Blue 62 Empower Foam, none, just water, sometimes soapy water,
Okay.
pre-cleanse, enzyme, endozyme sponge, Pro EZ, Empower, the best, Heavy Wipes, RUHOF bedside kit,
Oh, Ruhoff, yeah.
pre-cleanse.
Okay, so it sounds like most everyone is using something. For those of you that are using water or not using any kind of product like this, let's go through some of the point of use cleaning treatment products, and maybe, you might change your mind. Okay. Okay, so there are a lot of products clearly available for point of use cleaning that can help clean and keep instruments moist during the transport for reprocessing. Now, probably a multidisciplinary team should evaluate what's the right point of use cleaning treatment product for your facility. Don't pick this out on your own because there's always so much pushback with that. So gather a group together and figure out what's right. Point of use cleaning treatment products can help keep instruments moist to prevent soils from drying on them. They can prevent corrosion, staining, and pitting, and they keep your instruments functioning longer. Now, there's 3 common ways to keep instruments moist. The first is a wet towel or cloth placed over instruments after surgery, and this has been the traditional method for keeping instruments moist. It's pretty effective for short periods of time, usually about an hour. Then we have our spray-on gels or foams, which some folks mentioned. So these types of treatment products are designed to cling to instrument surfaces, and they penetrate joints and hinges, but they also reduce dripping or splashing, which is really important because instruments are contaminated with a whole bunch of soils, and you don't want those dripping all over the place or splashing onto your staff. Now, these spray-on products are formulated with cleaning agents to break down blood, soils, and protein, delay drying of organic soils, and keep your instruments moist. They will keep instruments moist longer than that traditional wet towel method, and they usually provide moisture for a couple of hours. For the exact recommendation, you need to check the manufacturer's IFUs. Now, spray-on treatment solutions that are enzymatic cleaners have been proven to be beneficial in the removal of biofilm. And remember, biofilm is our enemy. So anything that eliminates the enemy is something you might want to consider. Additional benefits of using enzymatic cleaners are they assist in the removal and breakdown of organic soils at a neutral pH. And this is important for your really delicate devices. So these products are gentler on devices. They clean with reduced mechanical action in hard to reach areas. So they begin cleaning without damaging devices, and that reduces the amount of scrubbing that's maybe needed later on down the road in reprocessing. They offer a broader range of material compatibility than some of the alkaline chemistries for delicate instruments. And some also contain anti-corrosives that can help reduce the likelihood of damage to the instruments. One thing to note is that the point of use cleaning treatment product dispensers should not create aerosols during dispensing. First of all, you don't want to aerosolize whatever it is you're treating, the debris and soils, you don't want those flying up in the air. And aerosolization has the potential of making the gel or foam airborne, where staff can inhale it. And some of these treatment products have some chemicals that are hazardous to breathe in. So it's important to know that they're applied in a non-aerosol generating matter. So make sure you check that out on whatever products you're using. Now, if you know there'll be routine delays in transporting instruments to decontam, like maybe you use offsite reprocessing, then products with an enzymatic activity are a good choice. Our third method for keeping instrument moist is a self-seal pouch with an absorbent layer sandwiched between two layers of transparent film. Now, the transparent film just lets you see what's in the pouch, and they're really simple to use. You place a specified amount of water in the pouch, you add your soiled instruments, and then you seal the pouch. And this creates a humid environment where the instruments stay moist until taken for cleaning. These pouches are a good choice if extended time, 2 or more hours, is needed before instruments can be reprocessed. And some studies have shown that instruments in these types of pouches can remain moist for up to 3 days. But consult the IFU on your specific brand for what they recommend. But remember, the sooner decontamination begins, the better. And some instruments don't tolerate extended storage in a moist environment, so be sure to consult with the device manufacturer. A good treatment product can help reduce the likelihood of retained soil on the instrument, reduce the time needed to clean that instrument, and save a facility from having to purchase replacement instruments due to corrosion and staining. Now, personnel should wear personal protective equipment, PPE, when performing point of use cleaning, treatment, and handling contaminated instruments. Your PPE should include fluid-resistant surgical masks in combination with eye protection. And the eye protection can be goggles, glasses with solid side shields, chin-lay face shields. But remember, if you wear a face shield, OSHA requires you wear a mask. You should wear a fluid-resistant gown. Gloves can be fitted at the wrist, or if you like to go with the evening glove style, you can go higher up on the arm. Liquid-resistant shoe covers should be used if you think there's a risk for your shoes to become contaminated or soaked with blood or body fluids. And don't forget to remove your PPE in the correct sequence. It's gloves, gown, face shield or goggles, mask or respirator. And also, don't forget to perform hand hygiene after removing your PPE. And since your gloves are the first thing that comes off, preferably after each step. Oh, Nicole, time for poll number 4.
All right, poll number 4. Launched. In your facility, who is responsible for point of use cleaning? Again,
Right.
it's
Another short
anonymous. Yeah. Short answer. We'll read them at the end.
This will be interesting.
Got 20 answers, 21, 32.
Come on, we got 81 people out there. Tell us who's doing it.
35.
Slowing down.
Yeah.
That looks like it's it. Oh,
40. 42.
keep them coming. We're curious. Or I am, I
All
guess.
right, I'll go ahead and end it.
Okay.
And I will read them off again. So, OR or procedural team, anyone using the instruments, OR assistant, scrub nurse, tech in the procedure room, the user.
Okay, that's fair. Okay, so it sounds like anybody who's using that device is responsible, and that's good to know. All right, we can get rid of this one, Nicole. Okay, so based on the survey, we can tell that medical devices go through many hands in various clinics and departments before they're transported to decontam for further reprocessing. So who's responsible for preventing dried soils on surgical instruments if every department is saying that it's someone else's responsibility? We've probably all heard that. Sometimes OR team members think instrument cleaning is only sterile processing's job, and they justify skipping point of use cleaning because they have too much to do. However, ARN and AST have their recommendations for the OR, and you all get it. They say it's the responsibility of the scrub personnel or the OR tech, someone in the operating room. But actually, the real answer is based on your survey is correct. Everyone in every department that uses surgical instruments is responsible. Now, a good way to help establish a team approach to point of use cleaning is to get all of the stakeholders involved, any department or area that uses and transports surgical instruments, because if you don't, no one will take responsibility. And it sounds like you've all kind of worked together as a team to establish a process that works for your facility and area. So that's great. Now, the steps for point of use cleaning should be well thought out. A multidisciplinary team should develop a process that is compliant and realistic. The process and protocol should include local, state, and federal regulations, things like OSHA, the FDA. For those of you that use offsite reprocessing, don't forget the Department of Transportation. You should review requirements for the Centers for Medicare and Medicaid Services, CMS. Look at manufacturers' IFUs. Review evidence-based standards or guidelines. There's ANSI, AMI, ARN, ASTA, AST, SGNA, the Society of Gastroenterology Nurses and Associates, for scopes, and the CDC, Centers for Disease Control and Prevention. But also consider these factors when you're trying to develop your process. Logistics. Where does it make sense to perform that point of use cleaning so the product will be easily accessible and the process easy to perform? Time. For the OR, get support to build in time for surgical staff to wipe off debris, flush instruments, and arrange them correctly. Time may also be a factor in other areas and departments, so talk to the users and work out a process together. And it sounds like you've done that. Training. Explain when in a procedure point of use cleaning takes place and why it's so important. Training should be part of a rollout or a refresh, but also included in new employee orientations and annual competencies, and when products change. Every employee who is responsible to perform point of use cleaning needs to be able to speak to the process and actually demonstrate it. Supplies. Determine who will order the product and restock it for every area that performs point of use cleaning. Compliance. Create a facility, department, or area specific plan for monitoring and feedback of your point of use cleaning process. A well thought out process encourages teamwork and reinforces compliance through time and repetition. Now, regarding your cleaning protocols, a point of use cleaning protocol can help standardize that agreed upon process. And as I said before, you need to consult local, state, and federal regulations, review device instructions for use and professional guidance, and reference these documents in your protocol to demonstrate that the product and protocol selected are compliant with best practices. One other thing to remember is that the more specific you make that protocol, the closer you will be held to it by a surveyor. So don't name a specific product in your policy. Use some language that allows for some room for variation while still holding the staff accountable to wipe off and flush instruments. Now, regularly monitoring that point of use cleaning process through audits and feedback is one of the most effective ways to confirm ongoing compliance. Audits can help show gaps so methods can be refined to improve the process. So maybe round on units where point of use cleaning is happening and observe if all of the steps are being performed correctly. Or try to randomly check an instrument set in the decontam area to see if it's been appropriately point of use cleaned and treated. If you use a colored or foaming treatment product, this makes it a lot easier to tell what's been done. Or if staffing and time allow, As sterile processing receives instruments from the OR and other areas, have them record the percentage of compliance observed with point of use cleaning and treatment. Now, there are some instrument tracking systems that can do this for you, or you can do this manually. If you track the percentage of compliance observed in these audits, you'll determine if retraining is needed. But also, don't forget, this is your opportunity to provide feedback to those that have done a good job of point of use cleaning. So starting an effective point of use cleaning process for your facility isn't easy. The increasing use of complex devices makes it more important than ever to make sure every device is being point of use cleaned and reprocessed according to best practices. Surgical site infections occur in 25% of major surgical procedures, with contaminated devices as one cause. If the goal is sterilization or disinfection, then point of use cleaning is a critical first step in device reprocessing, because if it isn't clean, it can't be thoroughly sterilized or disinfected. Point of use cleaning begins in the OR or any procedural area in any healthcare setting at the location the device was used, wherever that might be. Point of use cleaning decreases the number of microorganisms on the surface of devices. It prevents the formation of biofilm. It reduces the risk of surgical site infections. It increases the efficiency of the decontamination process, and it maintains your really expensive instruments in good working condition. Performing proper point of use cleaning throughout and immediately after each procedure will promote safe, efficient, high quality care that patients deserve, lowering the risk of a contaminated instrument getting through the entire reprocessing cycle. Don't skip this step. Here's some resources for you. Thank you.